Hello, everyone. My name is Susan Fishbein. I am a licensed clinical social worker and senior social work coordinator at Hospital for Special Surgery in New York. I have been facilitating the myositis support group there for the past 13 years. I also maintain a private practice where a specialty of mine is helping people with chronic medical conditions. Thank you, everyone, for joining me today as I present on some of the emotional challenges in living with myositis and some ways to help manage them. As you know, we've been living through unprecedented times. I have heard it said that some people with myositis feel that their lives have not changed very much, that they've lived lives of caution and isolation due to their disability. And while this is understandable, it cannot be denied that the world at large has been altered, even if it feels less so on a personal level. There have been over 650,000 deaths from COVID in the United States alone, and many more are left vulnerable and have suffered as a result of these losses. In addition, the pandemic has further exposed economic disparities, causing many people to feel increasingly uncertain about employment, finances, housing, and access to medical care. We have also been facing an even greater uncertainty about what the future may hold. Guidelines and direction about safety protocols and vaccinations can be confusing and may have caused rifts among friends and family members. Many have found it challenging to cope with the losses that have already occurred due to myositis, causing feelings of isolation and loneliness. One result has been the increase in anxiety and depression. During these times, it has been more necessary to learn to adapt to these changes and to be mindful of our mental health. So the goal for today's presentation is to help identify some of the factors that may be adding to our stress and anxiety, and to find some helpful tools and manage to gain a different relationship and a different perspective to them, thereby helping to build resilience as well. After this program, I'd like to ask you to complete the survey that's provided in the link in the chat box for the Hospital for Special Surgery's Department of Social Work Programs. This is in order to help us for future program planning. Also, the chat box can be used in addition to asking questions, which will be answered at the end of this presentation. If you have any thoughts and suggestions, any tips that have worked for you in helping to manage difficult times and difficult emotions, I welcome your entering those there. So we shall continue with our presentation. So the objectives for today's program is to learn the possible risk factors for the emotional challenges in chronic illness, to learn how myositis may increase the chances of these emotional challenges, to learn how COVID-19 may have increasingly impacted those emotional challenges, and to learn strategies for coping and building resilience in managing these. Some of the factors that may increase the chances of experiencing depression and myositis. Research shows that people with chronic illness are 2 to 3 times as likely to have depression as those without a chronic illness. During the pandemic, rates of depression have tripled. Having a chronic illness can cause feelings of helplessness, hopelessness, isolation, fatigue, and the inability to do things that once brought you pleasure. There can be a sense of loss of control over one's life. These are the same feelings that can cause depression. We will discuss some of the factors that may contribute to depression and the impact that these factors may have for people with myositis. But first, let's review some of the signs and symptoms of depression. So very often people think of depression as being unable to function. And so if you're not in that state, you feel that you may not be depressed. However, there are many more subtle signs and symptoms of depression, and we're going to discuss that right here. It should be noted that in order for a clinical diagnosis of depression to be made, 5 of these symptoms must exist, and one of them should be loss of interest in activities or hobbies that were once enjoyable and or suicidal thoughts or attempts. They should have lasted for a period of 2 weeks and experienced every day or almost every day. The signs and symptoms are depressed mood marked by continued feelings of sadness, anxiety, or emptiness, crying, often without a reason, feelings of hopelessness and negativity, feeling worthless and helpless, feeling irritable or restless, loss of interest in activities or hobbies that were once enjoyable, including intimacy and sex, fatigue and decreased energy, loss of concentration, a change in sleep patterns and appetite, and suicidal thoughts. Some of the other contributing factors for people with myositis and possible impact, there's the physical limitations, pain, which produces reduced range of motion, weakness, fatigue, medication side effects, lead to less physical ability, feeling more alone and isolated and less able to do things. Especially for people with IBM, there is the increased fear of falling, often without any warning, and then the difficulty in getting up because of the lack of upper body strength. There can be difficulty swallowing, which results in your being unable to enjoy foods that you once did enjoy. Myositis is rare and it's considered an invisible illness. You may have heard comments like, well, you don't look sick or you look fine. This may invalidate how you are feeling physically and emotionally. And because myositis is rare, there's often the insecurity of medical care. It can take a very long time to be diagnosed, and even more difficult time finding doctors who understand and treat people with myositis. Many have heard comments like, you're my first myositis patient, or you know more about this disease than I do. Not very reassuring. You may also be seeing many specialists, and communication among your doctors may be poor. This has been associated with an increased risk in depression. You're not feeling well, or maybe you are angry about what has happened to you. There can be physical challenges, as we've mentioned, all of which can affect self-esteem and self-image, and therefore a desire for intimacy. While recognizing that having myositis is but a part of who you are, a diagnosis of myositis is a life-altering event. Your identity, who you are now, may be affected. How will my role as a parent, partner, son or daughter, employee or employer change? Because the course of this illness can be unpredictable, it is often difficult to plan activities, and friends may be reluctant to continue calling only to have plans canceled. And again, this can lead to feelings of further isolation. Education and career for people who are younger and may be seeking higher education, going off to college. You may now have to think about whether you can go away to school, whether you have access to medical care, and whether accommodations can be made in your assignments and you're traveling to and from your classes. Likewise, if you have already a career, your current employment might be affected. You need to consider possible issues of access, the ability to meet employment responsibilities, and how much to reveal to your employer as you try to manage your medical condition with doctor's appointments and various treatments. I will say that one silver lining of the pandemic has been that many people who are able to have been working from home, and the landscape of what office work will look like in the future may definitely change, giving you more flexibility to work from home and therefore easing possible challenges of working from home. We're also dealing with the impact of COVID-19. It is important first to acknowledge that it is normal to have been experiencing a wide range of emotions at this time. Accepting your feelings is a step toward building resilience, which we will define here as the ability to recover from difficult situations. Some of the emotions that you may have been feeling are much like what we've already mentioned: anxiety, stress, worry, fear, loneliness, isolation, feeling overwhelmed, frustrated, and angry. Research again has shown that the rates of depression have tripled during COVID-19. So stress, something that many of us live with every day. Research has shown that stress can have a negative impact on your overall health. Many of us experience stress physically: sweaty palms, racing heart, knots in your stomach. This is a fight, flight, or freeze response that is controlled by a part of the brain known as the amygdala. We are hardwired for this response when we sense danger or threat. One definition of stress is it is what happens when something that you care about is at stake. A key element of stress is the perception of threat and danger. Recently, I've learned that in addition to the fight, flight, or freeze response, there is also another stress response known as tend and befriend, which encourages us to seek out social support because we, as humans, thrive in groups. Anxiety. Many of us live with anxiety every day. This can be described as the unhelpful thinking patterns that we experience when our minds fixate on threat, uncertainty, and negativity. Anxiety can occur on its own or as a response to stress. It's marked by the persistent and excessive worry that doesn't go away even when the stressor is gone. It's important, again, to note that you cannot control your anxiety from happening. Anxiety is a normal part of our lives, and it is your brain's automatic survival system. However, you can learn to control your response, your reaction to it, how much power that you give it. And some of this can be learned through techniques of cognitive behavior therapy, also known as CBT, and some of which we will be describing here. It's important to know that there are many ways to manage anxiety. There's lots of information online that we can learn about what can be done to help manage stress and anxiety. These are tools that can help build resilience, which again is defined as the ability to bounce back from difficult situations. We've all had to manage difficult situations. Challenges can be met on a daily basis, that sometimes your disease is under control and then suddenly it's not. Acknowledge and communicate how you're feeling to yourself and to those around you that you trust. Create structure and routine. This is really important. Sometimes we don't feel like getting out of bed or doing anything. I think that it's important to have a routine, but to be realistic about the things that you can accomplish in a day. So it's helpful to, for instance, get yourself out of bed at the same time every day, or at least wake up at the same time every day. Maybe do some stretches while you're in bed. Take care of your hygiene. Make your bed. It sounds trite, but it really can be very helpful because there's visible evidence that you've accomplished something in the day, although you may need help making your bed. During difficult and challenging times, try to limit your exposure to the media. And of course, here we're talking about the pandemic. Many people were glued to the TV 24/7, and there was lots of repetitive news and lots of news that we didn't know whether we could trust. So we have to decide on two reliable sources for information. And you can certainly listen to news in the morning to see what's going on in the world and at dinner time, but I would not listen to it continually throughout the day, and certainly not at bedtime when you're trying to go to sleep and you might hear disturbing occurrences. One important way of managing anxiety is to be able to build a tolerance for it. When we accept that uncertainty and therefore anxiety as a normal part of life. We can become more comfortable with it. One way I've learned to manage anxiety is to think of it as a passing cloud, that there's a blue sky and there's kind of like a cloud, which is your anxiety that passes. The important message is that it does pass. Work toward adapting and accepting changes as they occur. Many of you have had to learn this in managing your myositis. Learn for ways to problem solve, how to get things done rather than thinking, oh, this is not possible for me. I'll never get this done. Having kind of negative thinking rather than positive thinking. Try to avoid all or nothing thinking, otherwise known as catastrophizing, where you go to the worst case scenario. That if you're experiencing certain symptoms or you see a fellow person with myositis might be, having a very difficult time and your fear is that that will happen to you. Try to cut that short. One way to do this is to think about the fact that you really need to understand and think with your rational brain, because our anxiety tends to kick into gear our very charged emotions and it overtakes our rational thinking. So if you tend to do this, try to redirect your attention to the facts, to reliable sources. Try to think of distracting yourself from your thoughts. I've often mentioned to people that it might be helpful to just physically move away from the spot that you're in where you're having these thoughts and feelings. Empower yourself through the acceptance of yourself and others, that you're not perfect, that you're human, that these things will happen, but that you'll learn how to deal with it. Staying connected to others is extremely important, and we've all had to learn to do more of that through our online capabilities. Remember to check in on others who may be alone, even if you're alone. That can help you connect with one another and therefore be together. Practice kindness and compassion, both for yourself and for others. Remember to practice gratitude, the things that you're grateful for. Think about the things that you do have rather than the things that you've lost. Remember to acknowledge your care partners because they too have been working very hard in helping you. And also for people who look to religion or spirituality for comfort and for guidance. Some of this has been modified during the pandemic where people can't go to church, but it's also helped us learn that we can attend through Zoom. And this can help people who have felt too ill or unable to get up early enough in the morning to attend their houses of worship. So I think going back to that can really be helpful. But I'd also like to note that it's possible to choose when experiencing difficult emotions, what you do with those emotions, and to take advantage of the possible lessons from anxiety. For example, fear can cause you to worry and prevent you from being able to focus, or it can help you consider decisions more carefully and create deeper reflection. Worry can cause you to put off things that need to get done, or it can help you manage your expectations and become more realistic about them. Now, these suggestions may seem oversimplified, but they point to the power that you have to be able to choose how you react to situations, and they can produce more desirable outcomes. Some of the other things that we can do is we can use distraction activities, as mentioned before, such as watching comedy or your favorite TV shows. Netflix has been a real pal to many people, and it's been a source of discussion among people, just as book clubs can be. Playing board games, people have been playing cards and bridge games, mahjong online. Cooking for those who can, although many of us have felt that we've been cooking too much and gaining too much weight as a result of that. Indoor gardening, calling a friend to talk, and journaling. Writing can be very helpful. The written word can be very powerful. And it's not something that you need to look at as an assignment that you need to do every day. But just once in a while, when you may feel that your life is overwhelming you or your emotions are overwhelming you, just try to jot some things down to get it out of your head and onto paper. Support groups. Again, this has been a silver lining of the pandemic that we've learned for many of us who have felt technologically challenged, that we can learn to manage the computer and to join our support groups online. They have been invaluable during this time, and it's helped us to stay connected to our myositis community. And even when we go back to meeting in person, I think that we will all continue to have the option, I know I will, of having online meetings included so that people can access us from anywhere over the country or even the world. Mindfulness, meditation, and breathing, staying in the present. This has been so important. For the last 18 months plus, this has been the one thing that I have recommended to all who are experiencing anxiety and who are having trouble focusing. What mindfulness does, first of all, I would just like to say that it's not something that you need to devote an hour a day to. Even if you can just do 5 or 10 minutes a day, sometimes as little as 1 to 3 minutes a day. There are apps that you can download on your phone, and there are YouTube videos that are free that just if you do this on a daily basis, this will really help mediate your anxiety. So one of the things that it does, as I mentioned, is by focusing on your breathing, you learn to stay in the present. I know that some people with myositis may have issues with their lungs. So if you engage in any of the videos for mindfulness and meditation, and they instruct you to do deep breathing, remember that you can just do breathing. It doesn't have to be deep breathing. And again, it helps you stay in the present. For those people who say, I never focus, my mind wanders, that's really okay. And that's what you learn, that in order to get back to the present, you just need to focus on your breath. You can use this anytime, anywhere, and it's portable. This helps slow down the mind, and it helps, get rid of some of the adrenaline that we might be feeling as a result of our anxiety. The heart rate is slowed down. Also consider any type of movement. If you're in a wheelchair, you can move your ankles, you can move your wrists, you can move your fingers, move your hands, move your shoulders. And if possible, consider yoga, gentle yoga or chair yoga. And of course, I always mention that you need to consult your doctor before engaging in any type of physical movement rather, to know what is safe and recommended for you. Another powerful tool for helping us get through difficult emotions is to shift our focus to the things that we can control. So some of the things that within our control is following the latest information and advice from trusted sources. So you can choose not to keep the news channels on all day. You can choose when to go online and follow the latest reports. Focus on what you find is important. Follow your routine. Try to relax. Try to stay connected to others. Try to eat well, exercise to the extent that you can, and seek and offer support for yourself and for others. So most things are outside our control, unfortunately, but one of the things that we've had to deal with during this pandemic is what we can do to feel safe. So we can't control what other people decide is safe. They may feel that it's okay to go into public spaces without a mask. They may feel that it's okay not to get vaccinated. The important takeaway from this is that you should trust your own decisions and actions, and that respect your own level of comfort. We can't control what the government mandates for us to do during difficult times. Many people who are parents have had a lot of difficulty and challenges negotiating the schools opening and closing, with students being home with remote learning and trying to manage their own schedules with work and housekeeping and just the general chores of daily life. The recommendation I have here is just make sure you're prepared for the eventuality that this might happen. Cancellation of holiday plans. Many with myositis have already had to do this. You've tried to plan and then you've had to cancel last minute. We can't control our traffic, we can't control weather. We can only prepare for those instances and do the best that we can. Sometimes outside help is needed. And first, I would just like to really stress that there should be no shame in seeking help when it's needed. Depression, anxiety, and stress are treatable. In an emotional crisis where you feel that there is fear of self-harm, go to your nearest emergency room, or you can call the suicide hotline, and here is the number. Speak with your doctor or your healthcare professionals about referring you to social service agencies, community mental health centers, or to consider seeing a psychotherapist who's a licensed clinical professional trained to treat. You may also need to consult with a psychiatrist regarding antidepressant medication. Also, your religious and spiritual counselors are available, and they may direct you to counselors as well. Here are some sources for getting help. Again, this is the third silver lining that I'm pointing to here in this presentation. One of them has been that the increased availability of both telehealth and telemental health. So many people have learned to feel comfortable with this and can access these services online. For mental health, it's been invaluable because you can see providers throughout the country. These are national helplines, many of them. There are resources here who can match you with counselors that may take your insurance or that are for free. There's some more sources, especially for the coronavirus support chronic illness. I think this has been really a helpful resource. In summary, I hope that we've learned the importance of being mindful of our mental health. We've discussed ways to be able to recognize depression, anxiety, and stress. Some helpful takeaways are to learn to allow and accept your emotions, but also to be able to manage them so that they don't overwhelm you. Refer to the list of ways to help yourself that are included within this presentation, as well as activities that can distract you when you're feeling overwhelmed. There is no shame in seeking outside help when needed. I know that some people may feel uncomfortable entering questions in the chat or thoughts and suggestions, so I am available if you would like to reach out to me at this phone number or through email to answer any questions that you might need about helping to find resources for you. So if there are any questions, thoughts and comments, they are welcome now and can be entered in the chat box. Again, I welcome your tips and suggestions for how you manage your emotions, for sharing with us what has worked for you. And if we have time after the questions, I'd like to practice a guided visualization technique. From Lori, My Life app has been a mood check-in that will then suggest meditations that are relevant for how you are. I think that's wonderful. That's a great tool to use. Thank you, Lori. Many hospitals offer mindfulness-based stress reduction. Yes, that's true. And that's really helpful as well. It says that would love the guided visualization. Hope you can do today. When I'm feeling down, I always think of my grandkids. That's wonderful. So that's like visualizing actually something that makes you feel good, taking yourself to your happy place. So I think that that's really nice that you're able to do that, because that is a really good coping tool, is to take yourself to some place that makes you feel good, or think of people that make you feel good. I would like to go on with the guided visualization. I'm going to try to do that by not sharing the screen anymore and to talk you through the visualization. First, I'd like all of you to make yourselves comfortable. You can be seated or you can be lying down. I'd also like to note that I'll continue answering in the chat once we're finished with this guided visualization. This guided visualization was provided to me by Nancy O'Brien, who's a certified yoga teacher who has presented to our myositis support group at Hospital for Special Surgery, and also teaches guided meditation and gentle yoga through our patient education department at the Hospital for Special Surgery. So first, after you're comfortable, starting from your toes, gently squeeze and release in turn every part of your body, your calves, your thighs, your fists, your arms, your buttocks, your face. Expand your belly to the extent that you can with a breath in. Hold it in for a moment and sigh as you breathe out. Repeat this same movement with your chest. Expand your chest with a breath in. Hold it for a moment and sigh as you breathe out. Come to stillness. Imagine a healing wave or breeze or color, and begin to bring that healing energy to your toes. Continue on up, bringing relaxation to every part of your body, your skin, your joints, your muscles, your organs. Mentally, take a step back and see the body at rest, all cells on all layers of the body and mind. Bring the focus to the breath and simply observe it without changing it for a minute. Just notice the gentle rise and fall of the breath in the body. Bring the focus now to the sounds that you hear, both in the room, outside the room, and between your own ears. Without attaching the sounds to their source, simply observe and listen to the sounds coming and going. Bring your focus to a place in your body and your mind that is not in pain, and breathe into that area, noticing its texture, its feeling. As you breathe out, feel an easing of the borders of that area. Breathe in and just notice, and breathe out, feeling and easing. Do this for a few breaths. When you are ready, invite your focus to an area of the body and the mind that is in pain. and breathe into it. Once again, noticing its texture, its feeling. Is it sharp? Is it dull? Is it throbbing? Is it constant? Just notice the sense of the pain at this moment, how it feels. As you breathe in and then breathe out, invite a sense of easing a bit around the edges of the pain. Allow the breath out to carry with it some of the possibly protected edges of the pain. Do this for a few breaths. When you choose, return to the part of the body that does not feel pain and breathe in and out of that area, noticing its texture. Return again to the part that is in pain with the breath in and out, observing the pain and its texture, its sense in the moment. Bring the focus to the sounds again, observing without identifying all the sounds. Once again, squeeze and release all the muscles in the body. Now bring your focus to the mind. Allow your thoughts and feelings, sensations to come and go from a bit of a distance, as though you're observing yourself, like clouds passing by. After a few moments, observing the mind from a distance, allow the space between the thoughts, the clouds, to broaden and deepen, and gently inhabit that space, go into that space. Now, you may rest deeply in your own sense of wholeness and deepest source of healing for several minutes or longer. When you'd like, bring yourself out with gentle movement, deepening your breath if possible. Take a few moments to bring this peace, your own peace, back to the room and the rest of your day or your night. Before leaving, I would like to acknowledge and thank the Myositis Association for all your support and your guidance in helping me present today to help people with myositis face their emotional challenges and to learn how to manage them. And I'd also like to acknowledge the Hospital for Special Surgery, whose invaluable support I've received from the rheumatology division, especially Dr. David Fernandez, who is the medical advisor to the myositis support group at HSS, and to the Department of Social Work Programs, my colleagues there, and especially Roberta Horton, Assistant Vice President, whose support and guidance have been invaluable. Thank you.